Good morning and welcome back to K24 for G. It's Wednesday and here we like talking about matters health. My name is Mungala Mbuvi and today I'm joined by an esteemed panel of some very amazing women. The reason I'm saying this is because they are very strong. One of them is a doctor. She deals with such things every single day. I will start with the immediate one to my, this is left. Yes. How are you doing, Miss Kerubo?
I'm very fine.
You're fine?
Yeah.
Inakani kama umepatiwa kahawa mingi. Yeah?
I'm very okay.
All right. Karibu tena sana.
Asante sana.
Then we have Dr. Mate,
yes,
from MP Shah. Daktari, you know I was born in MP Shah.
Oh, very good. I told you.
Yes. Huko mlinidunga sindano mingi sana daktari. Mimi, I think I need to sue you because nowadays natembeanga kidogo na side moja.
No, feel free to come back. Come back.
Correct.
We can correct it.
We shall have that conversation for sure. And then we have Vivian Olusaka. How are you doing, madam?
I'm doing good.
Yes. And huo mtu umeshikilia anaitwa nani? Quinton, mambo? Ama that doesn't work with, okay, so. How old is Quinton?
Quinton is 1 year, 7 months now.
1 year, 7 months?
Yes.
Alright, sasa, mbona hujakuja na Quinton wako?
Okay, I thought that it was a little bit cold for her to come, so I left her at home.
What's her name?
Her name is Olivia.
Olivia.
Yes.
All right. The reason why these ladies are here, they are here to talk about congenital heart diseases. What that is exactly what their children went through. But Dr. Mate is here to explain to us what congenital heart disease is all about, or diseases. So, Dr. kindly just let us know. We hear of heart diseases, but now there's congenital before that. So, what is congenital heart disease?
Okay, thank you, Mbuvi. So congenital heart diseases basically means that this is a birth defect that is present well before the baby is born.
All right.
Hence the meaning of congenital.
Also, congenital means birth.
Yes.
Okay.
Before birth, something that happened when the baby was developing in the uterus.
Okay.
So we have a variety of congenital heart diseases. You have what is called cyanotic heart diseases.
What now?
Cyanotic.
Cyanotic.
So they make the baby turn blue.
Okay.
You know the way babies are born and they're nice and pink.
Doctor, I don't know. I've never been there.
See why you need to come back to Avisha and see what we do.
Okay.
So you have cyanotic heart diseases. So basically this means that they'll cause the baby to have poor circulation and the baby will have episodes where they turn blue.
All right.
And then you have acyanotic. So the child does have a congenital heart disease, but it is not affecting the circulation to a point where they're turning blue.
Okay.
So those are the two major categories of heart diseases. So in simpler terms, you may have what is called a septal defect.
Okay.
So you have 4 chambers of the heart.
Right.
And so the most common one is that you have a hole in the heart, as most people would like to refer it to. So this is a septal defect. Where you have
a septal.
Septal defect. You
Okay.
have the septum, which divides the chambers of the heart.
All right.
So you can have a hole on the 2 upper chambers of the heart, which is called an ASD. Or you can have a hole in the 2 lower chambers of the heart, which is called a VSD. And I'm sure as moms will tell you they've had these terms before, depending on the diagnosis of the children.
So we have the ventricles and the vena cava. I'm trying to remember my biology. Okay. All right. Anyway.
Yes. So you can have an issue with the septum. You can have an issue with now the what do you call them? The vessels of the heart.
All right.
Yeah. So where you have
the artery, the pulmonary artery.
Yes.
And the outer.
Yes. Fantastic movie. My work here is done.
Biology nilikuanga 96% by the way.
My work here is done. Can I go home now?
Yeah. No. Malizia.
Yes. So you can also have now an issue with the vessels of the heart.
All right.
So either you find that the vessels are channeling blood to too much blood into the lungs or not enough blood into the circulation.
All right.
So when these children are diagnosed, or how you will know the diagnosis, they have different presentations.
Okay.
So depending on the kind of defect that they have, you'll find a child who is born and from the get-go, you'll find either they do not cry immediately, or you find that the baby is blue. They have blue discoloration either around the tongue,
the mouth,
yes, or around the lips,
okay.
yes. And sometimes you have blue discoloration on the peripheries on the hands and the feet.
So is this discovered before or after birth?
At birth.
So akitoka tu hivi ndio unaona blue baby.
So there are those babies, especially with the cyanotic heart diseases, they will be born and you realize, okay, this baby is blue. Of course, you start the usual measures, put the baby on oxygen, keep them warm, but you find that there is this persistent blue discoloration of the lips, of the hands and the feet.
All right.
The other thing that you may realize, that one is a bit more dramatic, But you'll realize the baby is born and you give them to the mother to breastfeed, but this baby will have a very difficult time breastfeeding. They'll breastfeed for 2 minutes and then they stop.
Maybe usingizi anataka tu kulala.
Kuna hiyo,
yeah.
But then you also find that this baby is actually struggling to breathe.
Yeah. Okay.
So they suckle and they need to detach so that they can take a breath.
Yes.
So they're having a lot of difficulty in breathing and difficulty in feeding. And as a result, you'll find that these babies, as they're growing, they have very poor weight gain.
I'll just stop you there for a minute because I need to get something from Celestine Kerubu. So Celestine, how old is your baby?
She's 3.
3 years.
Yes.
So when she was, like Dr. said, there's a problem after she was born or while she was still in your womb?
Okay. Funny thing is that we never knew that she has a heart problem until she started walking.
But that's after 9 months.
Okay, she started walking at 1 year and a half.
Okay.
So all along she was doing okay, but sickly all through. So
was she crawling, for example?
Okay, she crawled at 1 year.
Okay.
So all along, like, she was in and out of hospital. So when she started walking, we noticed that she'd go for a short distance and then get so tired, at times convulse.
When you say short distance, is it like from here to this table? Is it here to the camera?
Okay, from here to the camera.
Okay.
So she couldn't even walk. And then she was so inactive. She couldn't play with other kids. Like, you see other kids playing, but for her, she's so just there. She doesn't want to interact with other children. So we decided to take her to hospital, and that's first we were told that she has rheumatic heart disease.
Rheumatic heart disease? Yeah. Okay.
So she was on medication for like 2 years there.
Okay. Okay.
So when we saw that there was no change, we decided to seek another cardiologist.
There was not even a slight change?
No, she was still tearing when walking. And then, so there's a doctor who even told us when she gets those tearing episodes, try to check on her fingernails and her toes.
What the doctor was saying, to look for the blue.
Yeah. So when we were now checking, we noticed that she's turning blue, and then at times she becomes so breathless and like just falls. Unamshikilia na anaanguka.
Nikawa amechoka sana
nika atembea, labda ametoka just a short distance na anataka kuanguka.
So when you took her to the cardiologist, walisema shida ilikuwa nini? What did they diagnose her with?
So when we went to the cardiologist, they told me that she has TOF.
Okay.
So I don't know all about TOF.
That is why doctor is actually. Doctor, what is TOF?
So TOF basically means tetralogy of Fallot. So
tetralogy overflow.
Tetralogy of Fallot.
Oh, of Fallot.
Yes.
In tetralogy of Fallot. Okay. All right.
Perfect. So this is 4 defects in the child's heart.
Okay.
So 1, you have what I talked about, the septal defect. You have a VSD between the 2 lower chambers. You have a hole in the 2 lower chambers. And then you have enlargement of one of the chambers. And then you have blood being diverted away from the lungs.
But I thought blood flows
through the
into
lungs
and out of. So
yes.
Okay.
So normally the blood will, when your heart beats, it will flow into the lungs where it gets oxygen.
Right.
And then it's pumped to the rest of the body.
Okay.
Yeah. So with tetralogy of Fallot, because you have this defect, the blood that is ideally supposed to be channeled to the lungs, you find a lot of it is being channeled into your body without getting the oxygenation that it requires.
So that is why Olivia, her daughter, kept on getting tired.
Blue, yes.
Yes.
And for example, when she exerts herself, when she walks or she tries to play, you find that then you'll have more blood being channeled into the body and it's not going through the lungs.
All right.
So you find that the more she exerts herself, the more she'll get breathless, and then she'll have the blue spells, which in her case would be called tech spells.
Okay.
And that's what she was being told. Observe your child. Do you notice that either when she's crying or she's exerting herself, does she get these blue spells?
Yeah.
Or these spells where she's breathless?
All right.
Yes.
Vivian, for you, what was up with this young man?
Okay. Quinton was born normal. Yeah, although through CS. And I did know there are I didn't know that he had some heart problems.
Issues, yeah.
Although at 2 weeks, he developed cold.
2 weeks, he
Yes.
got a cold.
Yes.
Okay.
So it has been persistent all through since 2 weeks. Yeah. And he had a problem with when he was suckling, he couldn't do it for, as in like 30 minutes the way it's supposed to be. He could suckle for a few minutes, then he stops. He used to sweat a lot. Yeah. And he was diagnosed with VSD at 8 months.
VSD?
Yes.
Do you know what VSD is?
There is that name.
Okay, that will tell us. And this is immediately how long after birth?
At 8 months. That's,
at 8 months.
Yeah, that's
okay.
when he was diagnosed with VSD. Although before that, he was so weak, and there were so many things that were revolving around.
Like what?
So many things were being said. Yeah, I was even in a panic.
They were being said by who? Your friends, family?
Yeah, people
your
around
husband?
us. People around us. Okay, I'm a single mother.
Yes.
So Quinton, for the first time throughout his life,
yes,
he has been underweight.
Okay.
Yes. Actually, at the first month, he gained weight very well. But from there, at 2 months, he started gaining weight in grams, 0.1, 0.2. Sometimes you go for clinics, there's no weight gain.
Yeah.
Yeah, but we never knew there was that heart problem.
So this entire time you did not know about VSD?
Yes.
Okay.
Now, okay, I was told that I had to resign at 6 months because it was too much.
Resign from work?
From work, yes. Actually, at 6 months, he was admitted. When I took him to the hospital, I was told that he has pneumonia. So he stayed in the hospital for like 3 days, 4 days there.
But didn't you need the money? Why did you resign and you needed money, especially now that you're saying that you're a single mom?
I thought that Quinton needed that special attention.
Okay.
Okay, something inside me used to tell me that he's sick, but
you didn't know.
I didn't know the real cause.
Okay.
Actually, at times my mom will tell me that huyu mtoto hakuli. You see, at that age, 4 months, unaambiwa upe mtoto uji.
Yes.
But right inside you, unajua there's something, but hujui ni nini.
Okay.
So during that time, tukaenda akakuwa admitted, kaonekana akona pneumonia.
Okay.
But I always say that was the time wange discover that problem.
Yes.
But it was not then. So after that, I had to go home. So one day when I was taking him to the clinic at 7 months, nikaulizwa mtoto anatembea, ana crawl. Mwambia no, it's just there, not that active. So nikabukiwa to see the pediatrician.
Okay.
So when I went there, after physical examination and taking of the history, we were referred to go and see to have him done echo ultrasound.
Okay. Yeah. So that's when they discovered.
That's when they discovered
VSD.
He has VSD.
Daktari, what is VSD?
Ventricular septal defect.
Okay.
Remember the 4 chambers that I told you?
Yes.
You have 2 upper chambers and 2
and
lower
2
chambers. So VSD is a defect or a hole between the 2 lower chambers.
Okay.
Yeah, the 2 lower chambers are known as the ventricles. So when you have a hole connecting the 2 of them, it's called the VSD.
Okay.
So basically in this case, you have now blood flowing from the left to the right. So you have too much blood flowing into the lungs.
Yes.
Hence why she was diagnosed with a pneumonia. Because the child will be breathless, they'll have difficulty feeding, as a result they'll have poor weight gain and even delayed milestones.
Okay.
So in her situation, this is what I talked about, acyanotic heart diseases. A bit more difficult to figure out because maybe you just think, oh, my child is fussy, they don't like eating. Or my child has poor weight gain, they're just a poor feeder. But essentially, there is a reason the child is not feeding very well.
Yeah.
They're constantly breathless. Like she said, he could barely breastfeed or suckle for 10 to 15 minutes without losing his breath. So you find these children will have other things which are not specific to heart diseases. So it's a bit harder for them to diagnose.
Yeah.
On the other hand, like she said, if you examine these patients is when you come to realize there's something going on. So for examination, you listen to the chest And ideally, what you hear is called a mama for her case.
A mama within the chamber, within the chest?
Within the heart, yes.
Okay.
So when you auscultate with the stethoscope, you hear a mama, which is basically turbulent flow of blood through this defect. So when you listen to the heart, when you listen to a normal heart, you're supposed to hear heart sounds. Yes. Yeah. Okay.
I'm just confirming. Sometimes I listen to my heart with a
and that is what you hear.
You
need to see a cardiologist for sure.
All right. All right. So you hear that mama.
Yes. So you hear a mama, and that is the first or the most common thing that you will hear from most children with a heart defect.
Right.
So at that point, then you proceed to have something called an echo, which is basically an ultrasound, to assess the structure of the heart and now kind of try and see what abnormalities are there in the structure of the heart, which is what happened to Quentin. He had an echo done, and then it was able to show the VSD, or the ventricular septal defect.
Okay.
Yes.
Wait. For you, Celestine, sorry,
yes.
She mentioned something that at one point she had to quit her job so that she can give the child special attention. For you, did you have to do something out of the kawaida to give Olivia, your daughter, special attention?
Okay, like I said, Olivia was sickly since she was born. So it's been even difficult for me to even find a job. You find that you get unemployment, and then after 2 weeks she's sick and you have to rush to hospital. So it was so hard to keep the job.
Yeah.
So I decided to take care of my daughter.
Yeah.
So
a job pia wewe?
Yeah.
Are you a single mom as well, Ama?
Yeah, I'm a single mom. Yeah, so it's been a struggle. So even her, as for her, she was gaining weight in grams since birth.
Okay.
So like in the first month, she had gained 2 grams. So in the second month,
2 grams?
Yeah. 2 grams from the weight at birth.
Yeah.
So even by the time she was 1 year, she was even not 10 kgs.
Yeah.
So when you go to hospital, doctors are asking you, what's wrong with your child? Does she eat? You like, yeah, she eats very okay, but she's not gaining any weight.
Yeah.
So it went to an extent that you were even given the supplement
to give the child.
Yeah.
And this is before any diagnosis, before they said about the TOF?
Yeah. So that time they were telling us that she has rheumatic heart disease.
Okay.
And they had told us that with rheumatic heart disease, it was to clear by the time the child reaches 15 years. So she was just taking the rheumatic heart disease drugs, but nothing, like mtoto kunywa dawa unastahili kuona with time mtoto ana improve, anacheza, anafanya nini, but nothing for her.
Right.
So that's when we now decided to seek
other opinions.
Yeah.
And for her, she said that watu walianza kuongea vibaya. I'm sure watu walikuwa wanasema maybe umerogwa. That is why you're a single mom.
Not that way, but yani vile watu wanafikiria hadi iterate time unaambiwa mtoto anafaa oshwe with those traditional herbs. Kwa sababu they are suspecting there is something.
Yes.
Yeah. Which
Okay.
I don't want to say it here.
Yeah.
Yeah. But I had to do, okay, as a mother.
What is that thing? Because I'm sure kuna watu, they're probably going through the same thing and they are wondering. I'm sure Ezekiel Mutua will forgive you. Just say it.
Ati unalala na different men.
Yeah. So it was even an attack on you.
Yes.
Okay. All right.
But okay, when I was told to do that, I didn't know the motive behind it. I came to know about it later. But anyway, he's doing fine.
Okay.
Yes. So I had to do anything. As a mother, you're going to do anything for your child.
Right.
Actually, even if it's seeking those traditional herbs, just to see the child get well.
Okay. Ulienda kwa wale wamasai wanatembeanga na vibuyu za brown.
Siku that point. But Quinton, okay, before I could diagnose with that, to the doctor, kuna hii the frontal, yes. Actually, it used to sing. So hiyo ndio watu walikuwa wanasema, wananiambia huyu mtoto ni mgonjwa sana.
Okay.
And one day utamka akiwa amekufa. Sababu it has sang hadi hapa ilikuwa imeprotrude kabisa.
Because of the pressure.
Yes, that tulikuwa tunaambiwa The only medicine ni traditional herbs.
Medicine.
Yes, so nikapewa. And that the very first day, Quinton cried a lot.
By traditional unamaanisha kwenda kwa mganga?
The
herbs.
Yeah,
okay.
Those herbs.
All right, Sasa. I want us to take a short break so that we can talk about probably, now that we know the problems, get to know about the solutions and of course your struggles, because I'm sure there was a lot of financial pressure on you, especially the fact that muliacha makazi and you're single women. Yeah. We take a short break right now, though we'll be back in a couple of minutes. All you need to do is find me on Twitter, Facebook, and Instagram at K24TV and give all the questions you have, especially now that Daktari is here. Let us know if you're going through something similar, if you want to get some kind of special consultation with Daktari. We shall definitely give you those contacts in a couple of minutes. Don't go anywhere.